My name is Ann Taylor. I am the Director of Community Engagement for Melanoma. It is always a pleasure to work with Providence Cancer Institute. We're so happy to be co-hosting today's symposium with them. I want to be sure and thank our panelists for their collective wisdom today. And I am going to have an opportunity to tell you more about melanoma at the end of today's symposium. But before that, what I want to do, because I know there will be many, many questions for our panelists, I want to explain how our Q&A session will function at the end. If you are joining us via Zoom, if you look at the bottom of your screen, you will see that there is a comment section. You're welcome to let us know where you're viewing from. But if you have a question for one of our panelists, please put that in the Q&A tab. If you are joining us via YouTube or Facebook, you can put your question into the comment section and we will transfer it over to the Q&A session. And so with that, I'm going to thank Chris Fountain for serving as our moderator today, and I'm passing the virtual podium to him. Thank you, Chris.
Hi, good morning or afternoon, wherever you're zooming in from. Excited for all of y'all to be here, and it sounds like there's a big group, and to talk a little bit about history of melanoma and then what the future looks like. As Ann introduced, we are from the Providence Cancer Institute. You can see us here wedged in between the I-84 and the Laurelhurst neighborhood. A building that started in the 50s and has since grown. The topic today is living with melanoma, and here's another peek at the front of our cancer center with the nice covered entry for a rainy Pacific Northwest. Like I said, my name is Chris Fountain. I'm a clinical research coordinator with Providence Cancer Institute. I've had the privilege of working in oncology for the last 21 years, more recently in clinical research. Fun thing to share, outside of oncology, this is one of the places I love to be. Had the opportunity to do some backpacking this year on Catalina Island. We did this amazingly for an anniversary, 45 miles, and what an adventure. The other adventure that we've been on for a while is trying to treat melanoma. If we go way back to the 1970s, we see that we had very few options to treat melanoma. And then we had this big gap until 2011, where we had our first immunotherapy approved, ipilimumab. And that was approved in the metastatic setting after progression on other treatments. We quickly moved and started seeing approvals on more targeted therapies. Now we're seeing combination immunotherapies in the first line setting. We saw improvement in our targeted therapies with better, cleaner oral drugs. And then more recently, we've seen TIL therapies, first tumor infiltrating lymphocytes approved in the melanoma space, and treatments approved for uveal melanoma. To go back a little bit in the history, we also did studies like this, which Dr. Curdy will recognize. Lots of drugs that we no longer use in melanoma, with outcomes like toxicity is unacceptable. Since then, we've moved further and are looking in what we call the adjuvant or neoadjuvant setting, so prior to surgery or right after surgery, looking at where these immunotherapies fit in to avoid metastatic disease in our melanoma patients. This is really exciting work, and both of these studies have published and given our providers more direction in how to treat folks with early stage melanoma.